Illegal immigration and the Social Security and the Medicare Trust Fund. My name is Ed Weir. I'm a former Social Security manager. I ran the third busiest Social Security office in the country. If you're new to my channel, I've helped hundreds of thousands of people out with retirement, survivor, spouse benefits, and my kind of semi-retirement after retiring from the federal government. I've made over 500 videos. I am doing a live Q&A. The live Q&A will happen after we'll talk about the trust fund and the immigration and how that affects the trust fund. And most importantly, I want to we want to focus on the long term in terms of making Social Security and Medicare stronger for the next 10 years, 20 years, 75 years. But my number one mission right now is to make sure everybody out there right now is getting the check that they're supposed to. So I am going to talk about that as well, and then we'll do a live Q&A. So the first topic of the day will probably take about 10 or 15 minutes. And then as usual, I'm going to open it up. So if you have any questions, make sure you type them into chat. If you're watching this as a recording, because the live is already done, make sure you subscribe and join my next live Q&A, because you'll be amazed how many millions of dollars we're finding for people out there. All right, so let's go ahead and get started here. This is a live. All right, so yeah, there's going to be a lot of changes, tons of changes coming up. There's a brand new commissioner that's coming up, so I want to make sure everybody keeps update with all the changes. Tons of changes with Medicare. Medicare is paying the insurance companies a lot less going forward. There's new catastrophic changes for Part D. There's just so many different changes out there in Social Security. So make sure you subscribe, and that way you keep up to date. We like to think here that there's because there's a lot of clickbait out there, a lot of I'm an old Marine Corps sergeant, a lot of BS out there on social media. And there's the big one this week was $600 check coming. Social Security actually had to put it on their website. No, there's no $600 check coming. So there's a lot of clickbait and false information out there. So I like to think that the places to go is ssa.gov, medicare.gov. And if you want to learn how all that stuff is in actual English, come on over here and we can help you out. All right. So the nature of illegal immigration and the issue with the trust fund, the nature of it is in the earnings record. There's a master earnings file. So basically everybody that paid into Social Security going all the way back to 1935 when they used to do it, there's some old pictures of how they used to do it. It was all paper and books and everything, but we've become relatively computerized since. But there's a master earnings record, master earnings file that everybody that pays into Social Security, Medicare, the 6.2% that you pay, the 1.45% you pay for Medicare, and your employer, or if you're self-employed, you pay the other part of it. So all of that is accounted for in this master earnings file. However, there's a lot of money in there that's what is in what's called a suspense file. So let's focus on you right now. Again, we'll talk about the big picture, and I appreciate everybody wanting to focus on making sure Social Security here is for the long term. But my number one focus is you and your family and friends, coworkers right now, making sure you get the benefits you're entitled to. So this suspense file, there's billions of dollars just sitting in this kind of suspense, dormant kind of file here that is, those earnings aren't correctly attached to anybody's Social Security number, anybody's work record. So how do you make sure you get that fixed? Is you go onto ssa.gov, set up a My Social Security account, and go in there and check out your earnings record. Same thing many years ago. People remember they used to get the statement once a year from the Social Security Administration, and you would go in there and you would say, oh, okay, looks like they've got my earnings correctly reported for last year. And then you put it in your file and you go on and get another one next year. They stopped doing those letters a long time ago. So a lot of people are not checking those. So please, everybody, your children, your grandchildren, cousins, parents, everybody, make sure they go in there once they file their taxes, March, April, go in there a few weeks later into ssa.gov and just double check and say, okay, because how it goes is you file your taxes, you notify the IRS of how much you made and how much you paid and FICA and all that stuff. And then the IRS notifies Social Security. And somewhere along the way, it gets missing, it'll show up on that earnings record. So once you file your taxes, a few weeks after that, go into Social Security and just confirm, okay, there they are. Because the problem is, if you don't, and then 10 years, 20 years, 30 years, 40 years later down the road, you might not be able to get those earnings corrected. You might not have the documentation or whatever the case may be. So it's important that you do that on a regular basis. If you need help doing that, make sure you join one of my live Q&As. I can walk you through the entire process. I've done it hundreds of thousands of times when I worked at the Social Security Administration, because your benefit amount, particularly your retirement, is based on your high 35 years of earnings. So it's not the last year or the last 5 years. So you might think that, okay, well, 20 years ago, it looks like there's a year missing there. But hey, I only made $30,000. Well, that $30,000 might be worth $80,000 in today's money, because it's indexed for kind of an inflation. So it's important that those earnings are correct. If they're not correct, then you will get an incorrect benefit throughout your life. All right, so that's the immediate thing. So that's, a lot of people are missing money that way. But on this channel, one of the biggest things that people are missing money, they're just filing for the wrong benefits. They don't know they can file for, have disability and survivor benefits, or disability and spouse benefits, or that they get Medicare with disability, or they can file for, spouse benefits from a divorced spouse or independently entitled divorced spouse. Or they can file for retirement and disability at the same time. So I've got over 500 videos detailing all those, and there's exceptions, the exceptions on everything with Social Security, over 20,000 pages of policy. So that's why I think I'm day 74 of live Q&A every single day. So yeah, let's make sure you, your family and friends are getting everything they're entitled to. Okay, so now the big picture. What are we looking at here? This is a rather old one, but this is the newest one. In 2010, the actuary, the Social Security actuary, actually went into the suspense file and determined that there was about $13 billion every single year being paid into Social Security that is in this kind of suspense file, just kind of hanging out there in limbo. And they estimate that 13 billion comes from people that came into the United States legally in a visa, work visa type thing, but that they just overstayed their visa, or they came in illegally from day one, went down to the local swap meet, got a fake Social Security number, they gave it to their employer. The employer is actually supposed to check with Social Security to make sure that's correct, but maybe they need the workers, so they just kind of turn a blind eye and they let the person work. But the person works under this fake Social Security number. They pay the Medicare FICA tax. They pay the Social Security, the Medicare tax. Their employer pays their portion of it as well. And that money goes to Social Security. And the actuary determined that was about $13 billion that's going into Social Security, into the Social Security Trust Fund. That's per year. I looked around for everywhere, and there's one think tank that calculated it and tried to update it. And they said, based on inflation and trend lines and everything, it's probably about $27 billion today, but we're not exactly sure. I think the actuary, the Social Security Actuarial Office, needs to go in there and do a better accounting of this money. But there's an estimate, there's probably about $27 billion going into the trust fund again. And they estimate probably $6 billion of that is going into the Medicare trust fund. So $27 billion going into FICA, the Social Security part of FICA, and about $6 billion going into the Medicare part of FICA. All right, so you've got all these people working incorrectly, illegally, without correct documents, and they pay into Social Security billions of dollars every year. Are they going to get their money back? Well, no. That's kind of the good part, is that they make this donation to our trust fund and they never get it back. And I've taken hundreds of thousands of retirement claims, survivor benefits, disability claims. My office was the third busiest in the country. SSI, everything across the board. If you come in and you want benefits, you have to prove certain things. Obviously, with retirement, you need to prove your date of birth, disability, you need to prove that you're disabled. But on all of those programs, you need to prove that you're in the country legally, either through US citizenship or a green card, or there's a few other categories that Congress has determined allows us to pay benefits. But if you are not within one of those legal resident, you're here legally, then you're not going to get benefits. Your claim is going to be denied, period, end of story. If you're, people say all the time, well, my uncle's cousin's best friend's mother is getting benefits and she's not here legally. There's SSI OIG. Contact SSI OIG and inform them that someone is receiving benefits illegally. And I'm sure they'll check it. They get word about that all the time. They go check and it turns out they're receiving some other type of state program or county program, but not Social Security. So that money is going to the trust fund. If those people that worked incorrectly, illegally, and then paid into the system, if they eventually become naturalized or become legal or whatever the case may be, there are very certain limitations to where Social Security can actually go back and say, okay, you worked under a false number for 10 years and you paid into Social Security. Thank you for the donation. But now you're a U.S. citizen. Congratulations. Now you have a green card holder. There are very certain limitations, certain situations where Social Security can say, okay, you worked 10 years under this company. You have to show us that that was actually you. And they can transfer those earnings to this new Social Security number that is issued, because a new Social Security, a correct Social Security number has to be issued. And that person who is now legal can get those earnings. But I can tell you, my office, we had probably a couple thousand people every day that come into our office and phone and appointments and everything like that. And so that's, hundreds of thousands of people every year, third busiest office in the country. And in a yearly basis, we probably had less than a handful of people like that eventually became legal, eventually became citizens, and they would come in and, sometimes they were proved that they would be able to prove that that was them. But there was only about a handful of people, 1, 2, 3, 4. So that would come in every year and try to get those previous earnings attached to their new Social Security number. So it doesn't happen very often. So those billions of dollars are helping the trust fund, the solvency, and all the rest of it. Okay. So the live Q&A, I want to get into the live Q&A, but I want to clarify something uh, before we get into the live Q&A. I did a video, was it last few days, and I want to clarify something about people that receive disability benefits. Okay, so a lot of people think that if you receive disability benefits, when you turn 60, you cannot receive survivor benefits because you're on disability. That is incorrect. When you turn 62, you can't get spouse benefits or divorce spouse benefits because you're receiving disability. That is incorrect. You can get disability and survivor. You can get disability and divorce spouse benefits or spouse benefits. If those benefits for spouse benefits, if your spouse, divorce spouse benefits are twice your amount, then you get up to 50%. But it's minus your own. So if your spouse, you're entitled to $1,000 from your spouse. Okay? So $1,000. And if you get $400 from your own, then you'll continue to get your $400 plus the extra $600 from your spouse. Same thing on surviving spouse. If you're getting, 2,000, if you're entitled to 2,000, you're getting 1,000, then you'll get 1,000 on your own and plus another 1,000. You won't get 2,000 plus 1,000. So, but I wanted to convey when I was talking about that, you're still going to get disability. Your disability is still going to be there. It's just your spouse benefit, surviving spouse benefit, independently entitled divorce spouse benefit will go on top of that, but your disability will still be active. And some people, I probably should have explained a little bit better, but some people thought, well, I get disability and the full benefit on it. No, I just wanted to impress upon people that your disability is still going to, you're still going to have disability. You're just going to have other benefits on top of that, because people are paranoid, and rightly so, that their Medicare is going to stop, because you get Medicare after being on disability for 2 years. And people say, well, if I get survivor benefits, my Medicare is going to stop. No, no, no. You're still going to get disability benefits, but on top of your disability benefits, you'll get survivor spouse, divorced spouse, independently entitled divorced spouse, whatever the case may be, but not in terms of the number value, not, your $1,000 plus, $2,000. So it's minus your own. So I just wanted to clarify that a bit. All right. So I always like to keep these topics to about 15 minutes. And I did it today. So let's move into the live Q&A here and see what we got. All right, let's see. Reba and Bucker, hello all. Hey, what's up? Jerry, Ed, some info for the folks. Recorded message on Social Security states MC application for future start date. You will receive letter for acceptance or need more info in 30 days before start date. Recorded messages on source. Okay, I have to listen to that and see exactly what they're. Can Social Security be garnished? Yes, I am doing a video. I usually plan my videos about a week or so in advance. This one was planned, the one I'm doing today was planned about a week ago. I heard there's something that happened last night, but this was already a pre-planned one, but I'm going to be doing one on garnishment. But long story short, yes, if a court order demands Social Security do X, Y, and Z, then Social Security has to do X, Y, and Z. So how long does it take to receive your Social Security once you apply? Well, there's a loaded question. Hey, Arlene. It really depends. If you're talking about regular retirement benefits, everything is correct. I've adjudicated hundreds of thousands of those, and before you walk out of the building, I pushed the button and adjudicated your claim. So it takes no time whatsoever. If you don't have the correct benefit, the correct documents, or there's something, an issue, scrambled earnings, as we used to call it. Scrambled earnings, again, the problem with that earnings file where you've got someone else's earnings on there, and or you're missing earnings. But if it turns to disability, you're talking about 6 or 9 months. If administrative law judge, a couple of years. So it really depends on what we're talking about here. We made our money, and they steal it in Congress. No, I did a video on that. Every single penny of the trust fund is fully accounted. You can double check for yourself on a monthly basis. Just go into the SSA trust fund. The Social Security board, and they do a monthly accounting of every single penny in the trust fund, so you can double check yourself. And it's a good cure for insomnia to read the board and stuff there. I started receiving Social Security this year. When will I know about the COLA raise? Yeah, you'll know about the COLA when everybody else does in October. So all of the COLA BS clickbait out there right now is completely useless. They're just people trying to get you to, go to their website. How COLA works is they determine, and I believe they use wrong numbers. I don't believe they use numbers not for elderly people, let's say. But basically, it's your third quarter of last year compared to the third quarter of this year. So we won't know anything. Everything is just a useless guesstimate until the first week of October, when it actually comes out. So TIZ, yeah, it took me about 2 or 3 weeks. Yep, good. COLA, yep, comes out in October. Now it's announced at the time for the incoming new year. Exactly. It's so COLA and the annual earnings limit, how much you can make, and all that kind of stuff is announced in October. Based on the presidential debate last night, it was brought up that Social Security will be bankrupt in 10 years. No, it's not. Yeah. So I think it's just, I've done a few videos on this. I try to stay away from politics. I don't mention, political parties or politicians' names. And I try to, because Medicare, Part A, Part B, there's, Medicare Advantage and Medicare supplements I avoid. I don't think I've ever mentioned a particular company, so I try to stay completely neutral. My mission in my retirement is to help you all get everything you're entitled to. But in terms of long term, I think that's kind of the powers that be on Wall Street have been trying to get the Social Security Trust Fund, those trillions of dollars, forever. And they've tried outright a few times to take it over to privatize it, and they weren't able to. So I think they're working the long game, and they're trying to build, kind of, just frustration and by deteriorating customer service, and just we're like, building all this mistrust of it. And so we just throw up our hands and say, yeah, whatever, let's just go ahead and give it to Wall Street. That's, and when they win, they win. And when they lose, we lose. Thank you, sir. Does 1099s count towards your Social Security benefit? And can you give a guesstimate of cost for supplement plan G? Do I need both or one will suffice? All right. 1099s count towards your Social Security benefit. Yeah, but you actually have to file the taxes on that. So 1099 means you're a subcontractor or whatever the case may be. And so no FICA taxes are taken out of 1099. So whatever, self-employment you have, this is self-employment basically. So you file your taxes and you notify IRS that you made X amount of money in 1099, and then you pay your FICA taxes based on your net income. So yes, that will count to your Social Security benefit. And guesstimate of cost for a supplement insurance G or N. They're different throughout the country. New York is the highest in the country. They're, like $400 or $500. But an N across the board, G, again, nationwide, a G is, 100, 110, 120, $130 or so. Plan N is usually about 20% less. And if you watch my videos, I always recommend Plan N because I like my money. And so I recommend Plan N, but a super, super, super close one is Plan G. It really depends on your particular situation. Nobody can tell you, oh, you should do this or that. It's complete, unless they've talked to you for a while. But I recommend Plan N. Plan G is super, super close behind. And then Medicare Advantage. Again, as I always say, if a Medicare supplement plan is in your budget, if you have the budget, then Medicare supplement all day long. If not, then Medicare Advantage. But there's more work with Medicare Advantage. You have to keep up on every year because those change every year. And this year, they're going to change the most. 2025 is going to be a big year. Medicare Advantage plans have been around for a couple of decades. This one is going to be the big one. The government is paying Medicare Advantage companies less money. They're going to have to deal with this new catastrophic Part D thing. They're going to have to come out with a letter mid-year saying, hey, you didn't use your dental benefits. And so people are actually going to start using benefits. And I hate to break the news to y'all, but Medicare insurance companies are profit-driven animals, and they're going to want their money. So they've already announced that they're probably going to be pulling out of places, particular companies are going to be pulling out of particular areas that, they're not making enough money, and they're going to be reducing benefits. And all of this, all of the board of directors and all the people that own this, all the billionaires that own these Medicare insurance companies, they are all hoping you don't check your plan and get to one that's more beneficial for you. They're hoping you stay with your old plan so they make more money. And a lot of people, unfortunately, do. They just say, well, it's still zero premium, still got my doctor, I guess I'm good. But then, then they have to pay, wait, it's not $100 for a hospital per night, it's $400. Wait, it's not $50 for a CTI or a CAT scan, CT or CAT scan, CT, MRI. It's, $1,000. So yeah, they're hoping you don't check, but please check, get with your agent or broker. And if you're new to this channel, I've put together, because there's so much bad actors out there, I've put together my own team of Medicare insurance brokers and the Affordable Care Act and all the rest of it. So if you need help, email me and say, hey, Ed, I'm good now, but put me on your list for October, and reach out to me in October and compare what I got with what is available in the future. And we will definitely do that. 100% free, of course. Tammy started Social Security in May. Fraud was actually in March. After many calls, I was promised a call back to change my start date to March. Going to take a month. Yeah. If the claim has already been adjudicated, then they have to go ahead and delete it. And whether a payment was already made, But yeah, unfortunately, it takes a little time to change the MOE, the month of entitlement, when you've already filed there. Um, but yeah, if they called, hopefully they've called you back and went ahead and addressed that. But it doesn't sound like it. So I would definitely reach out again. Vote the video up, everybody, even before the live stream ends. It will help move up the algorithm. Yes, please. That's all the, I mean, over, I think since I've been doing this live for about, what, 74 days straight, I think we found 10, 20, 30 million dollars or so in lifetime benefits for people. Um, and I mean, and this is only, we only get a few thousand views on these videos, and we found that much money. Could you imagine if, somebody famous, Keanu Reeves, or big fan of Keanu Reeves, someone famous retweeted us or shared us or whatever the case may be, and more people watch these videos, we could, we'd be getting, finding hundreds of millions of dollars for these people, for people out there, the people that need help. So these people, that was a bad way to put that, wasn't it? But anyway, for my peeps, yeah, all right. Illegals paying FICA, Medicare, good for Social Security. Annuitants, not good for people trying to immigrate legally. In my state, there are ways to collect Social Security, Medicare, and personnel are not allowed to ask status. Yeah, no, that's okay. For Medicaid, yeah, each state does Medicaid a little bit different. SSI, that's Social Security Administration, and no, you have to. Again, I had my unit in my office, SSI unit. We had 25 employees, and if they approved a claim without confirming that person's legal status, then yeah, that is fraud. And yeah, they would, as we used to say in the Marine Corps, they would be called on the carpet very, very quickly. So Medicaid, each state does it a little bit different. But SSI, retirement, Social Security, SSI, retirement, disability, survivor benefits, spouse benefits, you have to be here legally. So how does IEDS end up with more in their account if they're on disability? Yeah, I just had a email. Someone went down and they were receiving disability for a while and didn't know that they could file for independently entitled divorce spouse benefits, and now they are. They were kind of, it was only $67 a month, but hey, $67 is $67. Oh, speaking of, there's Megan right there. Yes, there's Megan. Hey, Megan. Just talking about you until I saw your chat. So it's Megan, but if I take the IEDS of only 67, I will lose my Medicaid and food stamps. So I'm better staying the way it is. Well, yeah, that's yeah, that's a decision that you have to make. Unfortunately, yeah, that's a tough decision. But Megan, I hate to be the bearer of bad news. If Medicaid finds out you've got other benefits that you're available to you and you don't take them, then they can hold it against you. But independently entitled divorced spouse, and as you know, Megan, even Social Security employees don't know about that one. So I'm going to, just between you and me on this one. And it's not, if you're receiving, let's say a Medicaid or SSI and you turn 62, particularly with SSI, they make you file for retirement. They force you to file for retirement. But independently entitled divorced spouse, I've never seen anybody forced to take that. So this is a decision you'll have to make. I mean, again, if the $67 is a reduction because you're filing early, the longer you wait up until your full retirement age, once you hit your full retirement age, that 67 might turn into $300 or so. I'm not sure your age right now, but so maybe you just take it then. And I worked for the Department of Social Services before I worked for Social Security Administration, and I've never heard of them forcing anybody to take independently entitled divorced spouse because pretty much nobody knows about it. And yeah. All right. What is COLA? Cost of living increase. Okay. Yep. Some of these. Let's see. My FRA is June 2025. What is the earliest I can apply? And will my first check be paid in July? Okay. So yeah, if your FRA is June 2025, well, you can apply now, but it sounds like you're looking for your full benefit amount in June. But what I would recommend is kick around the numbers. Think about receiving your benefits in January. Maybe you're waiting to your full, retirement age so you get the full amount, or maybe because you're working. But if you turn your full retirement age in June, it you know you can collect benefits in January, and next year you'll probably be able to make like $60,000 from January until May. Starting June, you can make $1 billion a month. So the annual earnings limit is not a big issue next year. So maybe kick around the idea of starting your benefits in January, a few months early. It'll reduce your benefits amount by 10, 15, $20 or so, but you'll also get 5 checks ahead of the game. So you might be able to get 10, 12, $13,000 ahead of the game for only a few dollars reduction. So check that out. But if no, then no. Then apply a couple of months before June, and your June check will come in July. And it depends on what day of the month you were born in, whether it's the second Wednesday or the third Wednesday or whatever the case may be. All right, Christine. I will be 70 in 6 months. I am receiving surviving ex-spouse benefits. I worked 4 years in Germany, have not filed retirement from them. Is that going to reduce my current benefits? No. Foreign pension does not affect on the GPO, government pension offset. That will not affect it. It might affect benefits on your own record, but you're receiving surviving spouse benefits, so you are good. If I have been married for 25 years, then divorced, but I have remarried, am I entitled to my first husband's divorce? You can remarry after the age of 60 and collect survivor benefits, but regular divorce benefits, no. You're now currently married, so no. A few days ago, my DDS asked if I was willing to undergo a CE. Of course, I said yes, but I found out a question a bit odd that she asked. Is that positive or negative? No, that's par for the course. So DDS is the Disability Determination Service. So she has a pending disability claim, and they want her to go see a Social Security contracted doctor. So it's a CE, as a consultative exam. So you can refuse those if you want, but it's not good to. So just go there and don't be shy. Tell them, a lot of people, stiff upper lip, and they say, yeah, I work through it. Tell them the truth. Be completely honest, and don't hold anything back, because they'll write up a report and send it to DDS. If I was married for 25 years and then divorced and then I remarried. Okay, all right. I think I just answered that one. I heard a week ago or so that this point COLA increase. Yeah, it's useless to talk about COLAs now. It's just clickbait, trying to get you to click their, sell you advertising. Has the Medicare application age always been 65? Yes, unless you're receiving disability. For disability, once you're on disability for 2 years, then you get Medicare. But in terms of everybody else, 65, yes, since 1965, when it was passed. How about benefits for veterans through SSA.gov? No benefits for veterans through SSA.gov. Those are through the Veterans Administration. But if you're a veteran, you can still get retirement, survivor benefits, disability, all the rest of it. If you're getting VA disability, you can also get Social Security disability. They're not mutually exclusive. All right, let's see what other questions. The differences between Medicaid and Medicare. All right, so Medicare is the federal program, the Part A and the Part B, and Medicare Advantage and Medicare supplements and all that. And then Medicaid is through the states, like California calls it Medi-Cal, because they're Californian. They always want to do everything different. But anyway, but Medicaid is a welfare-based program administered by the states. It's partly funded by the federal government. But Medicaid is low income, low resources. So a lot of people don't realize that you can have both. You can have Medicare and Medicaid. So if you have Medicare and you're having difficulty paying your Part B premium, that $174.70, please, please, please go down to your Medicaid office, Department of Social Services, Department of Welfare, whatever they call it, and apply for Medicaid. And if you're approved, then the state will pay for your Part B premium. And then you'll have Medicare and Medicaid. You'll be dual eligible. And in those cases, as I mentioned, I recommend Plan N Medicare supplements or a Plan G. But if you have Medicare and Medicaid, then Medicare Advantage is the way for you to go. Medicare Advantage dual eligible plans. Those are the ones that have a lot of extra benefits, the extra benefits that a lot of people want. But those for people with Medicare and Medicaid. So if you need someone to go through those, call me, leave a message, give me your name, your phone number, your state, because they're all state specific, and then say, hey, I want someone to go over my options for Medicare. Or you can email me and tell me the same thing. I'm a widow to a veteran. Is veteran check tax free? Yeah, I don't do taxes. Sorry. Can I move out of the country and still collect my Social Security? Generally, yes. If you're a U.S. citizen, absolutely, as long as you stay away from North Korea and Cuba. But if you're a green card holder, then go on to the Social Security website and click on Payments Abroad Screening Tool. Each country is a little bit different. They have different totalization agreements with different countries in the United States Social Security. So go into the Payments Abroad Screening Tool if you're just a green card holder. So yeah, if you're receiving retirement, survivor benefits, SSDI, yep, no problem. SSI, that's a whole different program because that's a welfare-based program. Why is it taking forever for Social Security to raise my check? Yeah, not sure what is the issue involved. This is crazy. Also, you get a divorce payout and 10 years later, here they come back big. Okay, yeah, so divorce spouse benefits. But divorce spouse benefits, so if someone was married to you for 10 years and their benefit amount was less than yours, less than half of yours, then they can get benefits on your record and you'll never know about it. So divorce spouse benefits, it doesn't affect your ex-spouse or their new family or children or whatever the case may be. It's completely separate. They won't even know you're receiving benefits. And it sounds like someone doesn't like that fact, but that's the law. Why do they not revert some people after 24 months? I've seen so many people that didn't revert. I'm not exactly sure what you're talking about in terms of revert. Divorced after 10 years, ex-husband dies at 56. Ex-wife is 65, still working, draws off ex-husband. Okay, divorced after 10 years. Okay, you got the 10-year marriage, good. Ex-husband passes away. Ex-wife, so you talk about yourself, is 65, is still working, drawing off ex-husband. Yeah, the question is asked kind of strange here. Let me see if I can figure this out. Okay, I assume you're talking about yourself here. So if you are 65, yes, you can collect surviving spouse benefits because you were married to that person for 10 years, or you were married to that person when they passed away. But if you're still working, you still have to limit your income. This year it's $22,320. If you're under that, then you can collect benefits. Anything over that, Social Security holds back $1 for every $2 you go over. So hopefully I got your question right. April, thank you for all you're doing. You're welcome. Which type of disability benefit will allow you to live in another country? Well, for Social Security, there's only two types of disability. There's either SSI or SSDI. SSI is the welfare-based program, and SSDI is Social Security Disability Insurance. So for SSI, you can live overseas temporarily, like under 6 months or so. But for SSDI, there's tons of people, living overseas forever. So SSDI, yep, if you're receiving SSDI, you're good. If applying for Medicare required at 65, if I'm still working and have full medical coverage. Joel, if you are currently working and you have health insurance from work and your employer has 20 or more employees, you are 100% good. You don't have to do anything. if you like your current plan. If it's got crazy high deductible and you just don't like it, then some people do, even though they don't have to. They get, Medicare Part A, Part B. But no, if you've got health insurance through current work, not a COBRA, not Affordable Care Act, Obamacare, not a retirement plan, but through current work, then you're good. You do not have to sign up for Part A. You do not have to sign up for Part B. You can sign up for Part A if you want. It's free premium for most people. If you paid at least 10 years into Social Security, it's free for the monthly premium. And so you get Part A if you want, unless you're paying into an HSA, health savings account. If you're paying into an HSA, then you can no longer contribute to the HSA if you have Part A. But if you don't have an HSA and you're happy with your current work from health insurance from work, your work or your spouse's work, then you're good. You don't have to do anything. So, when you turn 70 years old and you stop working and stop receiving health insurance from work, at that time, then you sign up for Medicare and you don't get any penalty whatsoever. You just have to provide a proof that you did have health insurance since you turned 65, and there's no penalty at all. If someone is here illegally but have children who are U.S. citizens here, can they collect SSI? I've been told they could. Yeah, the children, because the children are U.S. citizens, they can collect SSI. Absolutely. So it's the U.S. citizens that are collecting those benefits. For Medicaid to pay for your Medicare, do they count your spouse income too? Yes. If you're in the same household and all that kind of stuff, because Medicaid is a means tested program, welfare based program. If you're married to a millionaire, $1 million coming into the house every month, yeah, you're not going to get Medicaid. So yes, they do count your spouse's income. To Medicare after they have been on disability for 24 months. Yeah, not sure. Yeah, you get if you're on disability, you get Medicare after 24 months. That is correct. Is there a certain day that a person receives Social Security? Yeah, for the most of the time, it's based on your date of birth. So if you were born the first 10 days of the month, you get it on the second Wednesday. Second 10 days of the month, you get it on the third Wednesday, and stuff like that. All right, let's see. All right. Question. Divorced over 10 years, have Section 8 housing. Will income from Social Security be counted if the person takes Social Security from X? Yeah, any for Section 8 housing or anything like that, I'm sure they look at all the money coming in from Social Security. So, if you're receiving disability or spouse benefits or divorce spouse benefits or SSI or surviving spouse benefits, that whatever it is, Section 8 or whatever program doesn't know why you're receiving it, but they just know that you are receiving it. All right, let's see what else we got here. All right. Well, I think we've got all of the questions answered. Oh, here we go. How does Medicare.com get away with that website? Yeah, I agree. I think they're gonna crack down on them. Any company out there that has Medicare in their name, they're not supposed to be using it. They just changed that law last year, and yeah, Medicare this and Medicare that, and they're pretending to be kind of Medicare government related, even though they put up there, this is not a government, but they put it in really small print. So yeah, hopefully that will go away soon, because people are kind of tricked into thinking that's an official website. I'm on Social Security and SSI. I have an appointment scheduled with Social Security to get divorced spouse benefits. I have Medicaid and Medicare, and I was told I'm going to lose my Medicare when I first called. Yeah, not sure why you would lose your Medicare, maybe Medicaid. So if you're on Social Security, so SSI is the welfare-based program. The max you can get on that is $943. So it sounds like you've got other benefits from other sources that's less than that. Yeah, if you're entitled to those divorce spouse benefits, and sounds like they're kind of making you get those divorce spouse benefits, to kind of compensate for the welfare-based benefit because you're entitled to those benefits. And if you now are going to get $2,000 a month from divorced spouse benefits, then yeah, that might put you over the limit for your state Medicaid. But in terms of Medicare, that won't matter. If you're on Medicare, that won't hurt Medicare at all because Medicare, it doesn't matter how much you make. E-health gets away with too much too. Yeah. Yeah. A lot of these big call center, which I love. I don't love call centers. I love the fact that they're closing down because the government is doing a lot this year. The FCC and the FTC and Medicare, they've all kind of joined together and they're trying to kick out some of these bad actors, particularly ones, y'all can feel me out there. You're getting 20, 30 calls a day from Medicare insurance agents wanting to, do whatever. And how it goes is you click a button on Facebook or wherever, or some website, and they call you up and you say no. And then they take your information and they sell it to someone else who sells it to someone else and sells it to someone else. And that's how you get everybody in the country calling you. And if you say no to one person, doesn't matter. They've already sold your name to, thousands of other people. And there are particular call centers that, got hundreds of people. And that was their MO, is to just do that, harass people and call people and cold call people and stuff. And the government finally came down and said, no, you can't do that anymore. You have to get a one-on-one. So this person has to say, hey, XYZ Medicare insurance broker agent, call me. And then that person calls you, but they're not allowed to sell your information to a whole bunch of other people like that. So that's for us. So if you need help from the people that I have helping people with Medicare Advantage, Medicare supplements, the Affordable Care Act, if you need help from us, you have to contact us. We don't contact you. You have to reach out to us first, and then we'll reach out to you and give you all your options 100% for free and all that kind of good stuff. So, and Medicare, yeah. Yeah, if all is you're receiving is SSI, you don't get Medicare based on SSI. SSI is a welfare-based program for people that didn't pay into Social Security enough. If you're getting regular Social Security, retirement, disability, survivor benefits, then that comes with Medicare. Once you turn 65, obviously. So yeah. Yeah, if you lose Medicare, I'm not exactly sure why you would lose it, but if they're saying that you're going to lose Medicare because of whatever, then so it sounds like you're getting it based on a disability, and maybe your disability is ended or whatever the case may be. If for whatever reason, I would make them check that, because there are certain circumstances. So if you're receiving disability and you stop receiving disability because you worked and you earned too much, you're actually supposed to keep Medicare for 96 months. As long as the reason you're able to work is because you have health insurance from Medicare. So that's how they do it. It's like, okay, good, awesome, you're back to work and you're making a lot more money and you're being productive and you're enjoying work, awesome, but that means you're no longer disabled, so we're going to stop your disability. But we understand that the reason you're able to work and make all that extra money and stuff like that is because you have health insurance, Medicare, so they're able to continue your Medicare. That's one of the issues, one of the policies. Again, Social Security over 20,000 pages. That's one of the things a lot of people miss. They're just, every single day people miss stuff and don't get the benefits they're entitled to. So one day when Social Security does a better job at that, then I can retire again for the second or third or fourth time. I don't think you answered my question. Okay, I might have skipped your question. I'm also doing this on TikTok. I need 10,000 subscribers to bring TikTok over to I'm doing YouTube right now. I'm doing Facebook. I'm doing Twitch. I don't know why I'm doing Twitch. I'm doing Instagram. I'm doing LinkedIn and TikTok. So I'm broadcasting all of them. So all of these, except for TikTok, I'm doing on one screen, and you all are able to see my examples and stuff like that. But on TikTok, If it continues here in America, I need 10,000 subscribers because they don't let me do it correctly until I have 10,000 subscribers. So I apologize. So subscribe or come over to my YouTube channel and subscribe on my YouTube. And that way I can answer your questions better and I won't miss them. All right. So there's the logistics of that. Can I collect my ex-husband's of 25 years Social Security? Yes. If you were married to him for 10 years and his benefit amount is less, if your benefit amount is less than half of his, yes, you can. All right. I am 63, old widower on SSDI. Wife worked 30 years for a government job. How do I know which is worth more? Yeah, call up and say you want to file a surviving spouse claim. But as soon as you said work for a government job, then you need to confirm whether your spouse, divorced, deceased spouse, um, paid into Social Security. So old federal employees, this stopped in the 1980s. Politicians, they all pay Social Security. They not used to not in the 80s, but that changed. Um, but there are 5-6% of people in the United States that don't pay into FICA. Those are Texas teachers, Los Angeles teachers and firefighters, and Chicago teachers and firefighters and police officers. They have opted out of the FICA, out of the Social Security system. So if your deceased spouse didn't pay into Social Security, then yeah, then you won't be able to get benefits. But how you check is call up and schedule an appointment and say, hey, I want to file for surviving spouse benefits. And again, you're on SSDI, you're on disability. Your disability will continue. It will not stop. As long as you're disabled, you're disabled. Whether you get more benefits on top of that, again, if it's surviving spouse benefits, you can get up to 100%. You're 63, so you're not going to get 100% of what your deceased spouse was entitled to. If you start your benefits early, you're going to get a reduction. But call them up and say, yeah, I want to file for surviving spouse benefits. And they'll check. And if there's more money there, then they'll set you up an appointment and get you your money or give you your options. So if you're 63 and you say, okay, well, if I start my benefits this month, how much am I going to get? And they'll tell you, and you'll say, and then ask, okay, if I start my benefits this time next year, how much will it increase? And then they'll tell you that second number, and then you can determine whether you want to start it now or what you want, or whether you want to wait a year or two, or whatever the case may be. CPETs will say you are so helpful. Thank you. I appreciate that. For SSI separately now. Okay, wait a second. I missed part of that question. Someone applied for SSDI, sent denial, no medical review, and email thanking him for set up phone appointment for August. He didn't, suspects he doesn't have recent work credits for SSDI. Does he? Okay. Someone applied for SSDI, sent a denial, no medical review. Okay, so yes, look on the top of the letter, and this happens all the time. Is when you go into Social Security to file for disability, phone or an office appointment, the Social Security employee, the claim specialist, is supposed to address both programs, Title II and Title 16, SSDI and SSI. So if you're going to get, $1,000, $1,500 from SSDI, or if you're approved, you're not entitled to SSI. If you're only going to get $500 from disability, then you might be eligible for SSI, and they will ask you questions. Do you have any money in the bank? And if you say, yeah, I've got $10,000 in the bank, they're going to say you're not eligible for SSI. So they're still going to continue the SSDI application, but they're going to send you a letter, and it'll say right on the top, supplemental security income. It'll say, you're denied for SSI because you got money in the bank, or you're going to get too much money from SSDI. And the problem is Social Security employees. Okay, listen to me, Social Security employees. Make sure you tell people when you're denying their SSI and going to continue on with the other part of the disability application, remind them that, hey, you'll receive a computer generated letter in about a week, and it'll say you're denied for SSI, and that's because you told me you didn't want to apply for it, or you got $10,000 in the bank, or your SSDI benefit is going to be too much. So don't freak out. It's just the SSI part. We're going to still continue your disability application. You're just going to receive that letter. So make sure you tell people that. But unfortunately, people aren't telling people that, and they're freaking out when they get their denial letter. And I think that's another reason why they The whole internet myth about everybody's denied disability the first time. Please stop repeating that myth. It's not true. He turned 62 in October, but didn't want early Social Security when he actually disabled. Okay. Yes. Good. Let's face it. So, good. So it sounds like you might have had a part in informing this person. Information is a beautiful thing. So what she's talking about is when you file for disability and you're still under your full retirement age, disability claim takes 6 to 9 months if you're lucky. Some people just can't, hold out for 6 or 9 months with no income. So what you can do is file for retirement benefits and start your retirement benefits early. So turn your money on your Social Security retirement benefits while you're waiting for your disability to be approved. But caution, if your disability benefits are approved, depending on when they determine your disability starts, your monthly benefit amount might be reduced by the number of months you received retirement. So take that into consideration. People say, well, I don't care whether it's reduced 10, 20, $30. I need money coming in now for the next 6 to 9 months. But it looks like her friend just didn't want the early Social Security, but he knew that he had that option. So that is awesome. Thanks for sharing that information. Thank you so much. You're welcome. Kathy, wife is 56 and is on SSDI due to be enrolled in Medicare in December. Must she have only enroll in Medicare Advantage plan until she is 65? Pretty much. Yeah, that's the unfortunate part of Medicare supplement plans. States, because insurance is state, regulated. So in your particular state, probably the state doesn't make the Medicare supplement plans provide Medicare supplement plans to people under 65. Why? Because people under 65 that have Medicare, you have to have Medicare to get a Medicare supplement plan. People under 65, insurance companies know they're disabled and they use a lot of healthcare and they cost a lot of money. So they go to their state politicians and they say, hey, don't make us give Medicare supplements to these people. And then the politicians, get their, I'm not going to say what they get, but yeah. So in your state, that's probably the case. Or if they make the insurance companies provide, they provide not the good ones, not the N or the G, or they charge 3 times more. But yeah, when you turn 65, none of that matters anymore. No issues of you being on disability or pre-existing conditions. You can't be denied or charged any extra than anybody else being 65 years old. So that's what a lot of people do is they go ahead and get a Medicare Advantage plan when they get Medicare under 65. And then they keep that. And then when they turn 65, then check out your options and see if a Medicare supplement plan is right for you at that time. It sounded like a commercial there for a second. See if it, anyway. Yes, thanks to you, but I wanted to make sure that I'm giving him the right info. They denied his SSDI. Oh, they denied his SSDI claim. So I'm asking if he has to file another. Yeah. If the SSDI claim was denied within about a week or so, then that's a technical denial. So a technical denial is done by the local Social Security office. So that means either he's not insured for SSDI, he's not insured, or not currently insured, because there's 2 things. So you can be insured for disability benefits as long as you paid into Social Security for 10 years. But if you paid that 10 years, which 20 years ago, and then for the last 20 years, you didn't work, that means you're not currently insured. So maybe he did not work 5 out of the last 10 years. If you don't work 5 out of the last 10 years, then you're not currently insured. So that's usually a reason why people get the technical denial. So a technical denial is the first hurdle. And then if you pass that, then they send it up to DDS and do the medical portion. But it sounds possibly like it was a technical denial. But I would find out why. And if he disagrees with it, then yeah, file a reconsideration and say, no, I was I did work 5 of the last 10 years, and make sure he checks his earnings record and says, oh, looks like, this earnings weren't, added in there. So they add those earnings in there. Oh, okay. It looks like you are insured. So definitely check that out. You mentioned of applying for retirement with SSDI claim. Would that be for those under 62? No. Surviving spouse is a form of retirement. So yes, ish. If you're receiving disability, SSDI, and you're 60 years old and you're a surviving spouse or surviving divorced spouse, then yes, you can get surviving spouse benefits starting at 60. If not, then yeah, you can get um, divorced or spouse benefits starting at 62. If your benefit amount, your disability benefit amount, your PIA, which is the same for disability, primary insurance amount, is less than half of your spouse's, your current or your ex-spouse. All right, let's face this. All right, gave me a smiley face, so I think I got all her questions answered. And she is looking out for someone, so we like that a lot. Someone says Colorado state employees do not pay into FICA. Yeah, so there's another one in there. Wife worked at L3, changed to Raytheon. She should be 65 years old today. Oh, awesome. Happy birthday. All right, we're at an hour, and so I always like to keep these to about an hour. And so sorry if I missed your question. I will be back again tomorrow for day 75 consecutive dailies. And so make sure you jump in tomorrow, same time tomorrow, and put your questions up first, and I will